I'm Adrian Ghobrial. 2 years ago today, the first case of COVID-19 in Canada was discovered right here at Sunnybrook Hospital. 24 months later, and we're still in the grips of a deadly pandemic. We begin our story speaking with a leading doctor who talks about the missteps which have plagued our progress forward.
I said to a lot of people who asked me, I said, well, if you're a pessimist, this might go on for 6 to 8 months. And if you're an optimist, it'll end in about 3 months. And I can't believe how wrong I was.
Infectious disease specialist Dr. Gerald Evans is one of many doctors across the country who underestimated the virus. Canada's patient zero was first admitted to Sunnybrook on January 23rd. 2 days later, this press release was sent out by the Ontario government, confirming this country's first case of what was then called the Wuhan novel coronavirus. Just over a month later, the World Health Organization delivered this sobering message to citizens across the globe.
COVID-19 can be characterized as a pandemic.
Since then, 2.9 million cases of COVID-19 have been confirmed in Canada alone. More than 32,000 deaths nationwide have been attributed to the virus.
We never saw anything like this in terms of the sheer numbers.
Dr. Evans is a member of Ontario's Science Advisory Table. He's also worked on pandemic planning for influenza. When it comes to preparation, he believes there was one big oversight that very few, if any, saw coming.
What was going to be the impact of trying to understand behavioral science during the pandemic, how humans behave when they're asked to do things, and asked to do things not for a short period of time, but a long period of time.
Just days after a pandemic was declared, the World Health Organization issued this piece of advice to leaders around the globe.
The problem in society we have at the moment is everyone is afraid of making a mistake. Everyone is afraid of the consequence of error. But the greatest error is not to move. The greatest error is to be paralyzed by the fear of failure.
Dr. Evans believes the politics that have risen out of the pandemic have plagued the path forward.
We see a lot of political things that have come forward, and it's at all levels of government. So we've seen a lot of fragmentation of people's views on the pandemic that fracture right along those kinds of political lines.
It's important for us on the second year anniversary to remember that first case, but also to remember that mental health needs are going to stretch for years to come.
The Centre for Addiction and Mental Health released this survey, which found that Canadians are reporting the same level of anxiety, loneliness, and depression as they were near the beginning of the pandemic in May of 2020.
A young woman said to me yesterday, what do we have to do to move forward? I think many of us are feeling that. All of us are feeling exhausted, I think, of the pandemic at this point.
The road ahead, while unclear, does offer hope, according to Dr. Evans.
It is a potential exit point for the pandemic, in that we will have so many people who have either been infected or been vaccinated, that sort of global susceptibility to the virus infection will be lower. The danger, though, is this sudden emergence of another variant. Multiple infectious disease experts also note that we could see more variants arise if we don't get more equitable access to vaccines across the globe. I'm Adrian Ghobrial for CityNews.